Good morning. Many of you have been eagerly here in your seats for a while. Thank you for coming early on time. And those who are coming in now, grab some seats. We have some up front so you can see the slides really well, not on your phone. And welcome to the session on Spotlight on short-term rental, mortgage, and utilities. I'm eager to hear myself, whether it's STRMU or STRMU. I think it might depend on if you're from the east or the west, the north or the south. I'm not certain, but either one will now know what we're referring to. This is a really exciting time to be here, and I hope you're getting some great information. I know you will now during this session from our next presenters. Claire Donze, you've probably met already, and she's with the Office of HIV/AIDS Housing. She's been there a couple of years. One of her primary responsibilities is in the area of data collection and data collection strategy, so you can barrage her as well as the resource room with some questions. What you probably don't know is that Claire was in the Peace Corps and she was in China. So she's got some real interesting things that she's done even before coming to be so interesting at HUD. Mariah Ybarra has been a technical assistance provider, an activist and advocate and housing developer and expert since in HIV/AIDS housing, since before really the very beginning of HIV/AIDS. She was HUD's first TA provider with the AIDS Housing of Washington in Seattle, Washington, where they really were figuring out how to provide TA, how to develop housing, help develop a skilled nursing facility for persons with HIV/AIDS. She has real live experience as both a housing and services provider of services, was a director for a large housing and services organization, and now is, and as I mentioned, has been an advocate for services and housing for persons with HIV. And now, for those of you that have used or will use Ask a Question, Mariah is one of those, the women behind the curtain answering your questions. So she's been of great service to you all and to us at HUD over the years. Oh, and I am Lauren Deigh. I'm with the Division of Technical Assistance at HUD in Washington, D.C., and actually had worked with HOPWA for my first 4 years at HUD and was part of that curriculum development that you just heard about for employment. So that's really exciting to see how things are carrying on. So I'm going to stop speaking so you can hear from the experts, other than to tell you that for this session, it's being recorded. We're going to go all through this session. I'll look at the questions during the session, and then after the first hour, we have about 30 minutes left for questions. They won't be recorded, so we have confidentiality for that, but they'll be turned into FAQs later. And then finally, and I'm sorry I didn't say this at the very beginning, for those who are using the interpretation services, you can have your Spanish translation on channel 1. Without further ado, I'll turn it over to Claire, and thank you.
Hi, everybody. So without further ado, let's shine a spotlight on STRMU. Oh, and if any questions come up during the presentation, since we're taking them at the end, I need to do my mandatory app plug. So you can use the app to submit questions, and we'll be monitoring them throughout and answering them at the end. So let's shine a spotlight on STRMU. So the goals of this presentation: at the end, you'll have a deeper understanding of eligibility criteria and in which housing types you can use STRMU, documenting evidence of need and eligible uses of assistance, completing a comprehensive housing care plan. I'll talk about that in a degree of depth. Also, how to determine STRMU limits and other applicable STRMU requirements. I also want to say that this presentation and more information than what we have time to present today is in our STRMU guide, which is, and I say STRMU, I've heard it all ways. I'm from the Midwest, so maybe that's the Midwestern way to say it. So you can access the STRMU guide on the HUD Exchange, just HOPWA STRMU guide. And even the format of this presentation follows that guide. So if you want more information, that guide is your go-to for all things STRMU. So I also just want to throw in a quick reminder of our Institute's theme today, which is housing's role in ending the HIV epidemic. As we talk about STRMU, if you could just keep this theme in mind and keep in mind all the activities that STRMU provides that improves housing stability and outcomes for the populations that we serve. So these are the topics we'll be covering today. We have a lot to get through. And first and foremost, let's lay the groundwork with STRMU goals. So the goal of STRMU, first and foremost, it's in the name, to provide short-term stabilizing interventions to HOPWA-eligible households experiencing a financial crisis. And very importantly, STRMU is a preventative housing intervention intended to reduce the risks of homelessness, and it's intended for use with other HOPWA efforts to stabilize assisted households. So in other words, STRMU is not appropriate for households that are already homeless. It is a homelessness prevention strategy. So that's going to be my broken record for today. I'm going to keep referring back to the main goal of STRMU. So who is eligible for STRMU? First and foremost, to be eligible for STRMU, you have to be eligible for HOPWA. For HOPWA eligibility, the household must have at least one person who's verified to have HIV or AIDS. And for verification, there needs to be documentation of an HIV diagnosis from a medical practitioner who is competent to make such a diagnosis. So that's the first criteria. The second criteria is that the total gross household income must be at 80% of the area median income or below. So this is the eligibility to be in HOPWA at all, but then there are a few additional criteria for clients to be eligible for STRMU. So the household must have a legal right to reside in the residence, and I'll talk a little bit later about some evidence you can use to demonstrate this criteria. And also the household must demonstrate a need for the assistance. I'll talk about that in more detail as well. Also, one sort of caveat or special circumstance is if the eligible HOPWA household member is a minor, then there needs to be written verification of an adult in the household who is the legal guardian of that minor eligible child. And then the entire household income must be taken into account for STRMU income eligibility. And also that minor must reside in the household 51% of the time, at least 51% of the time. So again, if the HOPWA eligible member of the household is a minor child, so if the child is the one with HIV, then there's a few other documentation that you need to demonstrate eligibility for STRMU. So now, housing status. What types of housing status can STRMU be used for? So once again, this is my broken record, the goal of STRMU is to prevent homelessness, so it cannot be used for someone who is already homeless. So conversely, if the client owns their own home, owns their own apartment, rents their own apartment, they are eligible for STRMU. If the client lives in a mobile home, they can be eligible for STRMU with some caveats to that, being so a mobile home, motorhomes, trailers, RVs, these, if they have wheels and are capable of being relocated, so if they aren't attached to the ground, then we consider that personal property, and those are not eligible for STRMU. But we fall back on home guidance, which considers a mobile home that's physically attached to the ground and connected to utilities, and it must meet any other local guidelines. Those mobile homes are eligible for STRMU. So again, if the mobile home is physically attached to the ground, connected to utilities, and follows any local guidelines, then that is eligible for STRMU. Also, in that case, space rental costs in a mobile home park would also be eligible STRMU costs. So shared living situations, and by shared living we mean two separate households. They could be related or unrelated, but two separate households sharing a residence. That's how we define shared living, and this is also eligible for STRMU. Many grantees you can choose to allow this or not. If you choose to allow shared living situations for STRMU, then only the assisted individual's income, so not the whole residence, only the assisted individual's income will be used for assessment calculations. So some non-eligible household status types are hotel, motel, and emergency shelters because we consider someone in that housing status type homeless, and therefore STRMU is not appropriate for that individual. And also for anyone living with an adult family member. This also can be eligible for STRMU. If the entire household is assisted, then all the household income must be included in assessment calculations, and the entire household must therefore be under 80% AMI to receive STRMU. If a household member is just renting a room or a unit from an adult family member, a reasonable accommodation needs to be determined to see if that's an appropriate living situation. And then if they do receive a reasonable accommodation, then only the assisted individual's income will be used. All right, documenting evidence of need, because again, STRMU is needs-based and it is intended for use during a financial crisis. So the household must demonstrate a lack of resources to meet their rent payments or their mortgage payments or to meet utility costs. Also, it must be demonstrated that without STRMU, the household will be at risk of homelessness. So the grantees and project sponsors must establish a way to quantify and verify household needs. So this should include a review of all household bills, a review of bank statements to demonstrate that there's limited resources available, and also a review of income and household bills to see that there is not enough resources to meet those. On the case manager side of things, looking at current, past, and ongoing financial situation of the household, the employment status of household members, any benefits that they receive, and also if any HIV or AIDS health-related conditions keep them from working full-time, anything like that. And this budget review and assessment should be completed and included in the client file. I also want to make a special note that default and late payments are not a requirement to receive STRMU, but that can be used as evidence of need. So default late payment notice is not a requirement, and in fact, we hope that STRMU steps in before there's a default or late payment. So that can be evidence of need, but it is not required for someone to be eligible for STRMU. All right, what can STRMU be used for? How can it be used? Sorry, the types on this is pretty small. But again, the STRMU guide lays all of this out in even greater detail. So to use STRMU for rental assistance, the criteria to do so is that the household must have a legal right to reside in the unit and responsibility for paying rent. So what is some evidence of this? It can include a lease naming the tenant or the client or a household member as the occupant, a default late payment notice that identifies the client or a household member. Again, that can be used, it's not a requirement. And then if they show evidence of this, then they will be eligible to receive STRMU for rent payments. When it comes to mortgage payments, the client must demonstrate that they are the owner of the mortgaged real property. And some evidence to demonstrate this are a deed accompanied by a mortgage or a deed of trust that names the client or a household member. A mortgage or deed of trust late payment notice can be, again, it's not required, or a valid currently dated title insurance policy identifying someone in the household. Those are all acceptable forms of evidence for mortgage payments. And so if they demonstrate this evidence, you can use STRMU on the mortgage, on property taxes, on condo fees, and on homeowner's insurance if the homeowner's insurance is already included in the mortgage.
Condo fees as well.
Condo fees, yes.
As well, included in the.
Oh, included in the mortgage, I'm sorry.
Rarely is, so.
Yeah. So you can use STRMU for homeowners insurance and condo fees if condo fees and insurance are already included in the mortgage. Yeah, so if the condo fee or the homeowner's insurance is a separate bill, STRMU cannot be used for that. Also a note, thanks Mariah. Mariah's been doing this much longer than me, so I rely on her expertise. Also a note on second mortgages. STRMU can be used on a second mortgage as well. A second mortgage represents a lien on real property. So a default on any mortgage, be it the first or the second, could result in a risk of homelessness for the family, which is the goal of STRMU to prevent. So STRMU can be used on a second mortgage as long as the first mortgage is current. Is that right, Mariah?
Correct.
Mm-hmm.
As well as distinguishing, you cannot.
Yeah.
Thank you. You cannot use STRMU on a line of credit that's based on your mortgage. So many times people get confused about a second mortgage versus a personal line of credit that they can use like a credit card. Not allowed.
Yes. Thank you. And then lastly, utilities. So you can use STRMU for utility assistance if the client resides in the unit legally, and if they must demonstrate that they are responsible for paying the utility payment. So evidence of this can be a utility account in the client's name, or just proof of responsibility to make the payment, such as canceled checks, money orders, receipts, etc. I do want to point out that the utility account does not have to be in the client's name. So a lot of people, if someone has a criminal history or really poor credit, they can't get a utility account. So as long as they demonstrate that they are responsible for paying the utilities, the account does not have to be in their name for them to receive STRMU. So if they demonstrate this evidence, then you can use STRMU for utilities, but not for internet, cable, or phone service. All right, individual housing and services plans. So one of the first things that needs to be done with a client is a housing assessment. And this assessment represents an opportunity to gather information about the household's needs, their preferences, their challenges, their strengths, what housing situations worked really well for them in the past, what housing situations didn't. And this assessment informs the individual housing and services plan. So the individual housing and services plan is a requirement under HOPWA regulation, and every single client that receives HOPWA assistance must have an individual housing and services plan, not just those receiving STRMU. And yes, even if a client walks in the door and just needs $40 in utility assistance, supposedly once, they also still need an individual housing and services plan. Not only is this in our regulations, but also even if it seems like a one-time deal that they need utility assistance or whatever, there could be some underlying more systemic issues going on that will not be identified without without a service and housing plan. So every HOPWA client, if they're receiving any HOPWA money, they need to have an individual housing and services plan. And this should be completed in collaboration with the household. If the household has buy-in in the plan, they'll be much more likely to want to meet those goals and work towards the goals outlined in that plan. So it should be made in collaboration with the household. And a little bit more about these plans. I want to point out that our rental assistance guidebook has a lot of detailed information about how you can develop these plans with your client. It has multiple pages of suggestions and requirements, and also it has some example forms you can use when completing the plan with your clients. So I recommend that piece of material. It's the Rental Assistance Guidebook. You can find that on the HUD Exchange, and there's a lot of other really good detailed information about running a rental assistance program. So I want to plug that tool. And then just very basically, again, as I already mentioned, the individual housing and services plan should take into account the client's needs, their preferences, their strengths, and their challenges. And the individual service plan should identify goals for the client. Do they eventually want to be a homeowner? Do they, more housing stability? What are their goals? What are the resources needed to achieve those goals? Do they need more stable employment? Do they need to improve their skills in certain areas? What resources do they need? What assistance will be given to the client by the organization? So they'll be receiving STRMU, maybe what assistance will be given at that time, and also the estimated timeline for achieving their goals. And the individual housing and services plan, it should be a living document. HOPWA requires at least annual income recertification, so that can be the opportunity to revisit the plan and see how it's going, if it needs to be tweaked or revised, is the client meeting their goals or not. And again, there should be client buy-in with the plan. And again, the HOPWA Rental Assistance Guidebook is a great tool for this. And with that, I am going to turn it over to Mariah, who's going to talk about habitability standards.
Thank you. Lovely to see so many people I've worked with through the years. Thank you for coming. Glad to be here. My session portion is going to really be on the nitty-gritty that's required around habitability and some of the more regulatory requirements, as well as implemented practices over time. One thing, couple of things I'd like to say before I get started, and that is I have always thought that in the West, from the middle of the country west, it's STRMU, and from the middle of the country east, it's STRMU. So I'm a STRMU gal. And I have always thought that this is the most difficult of all of the HOPWA activities to administer because the assessment challenge is huge. Everybody is complicated. We have a disease of poverty. People come in with one crisis after another. And how do you assess when your client is sitting there in crisis? How do you make a decent assessment of need without being just a reoccurring payable because of other issues such as bad money management, those types of things? So understand that this is not black and white, and we will not ever be able to provide you with many black and white answers because assessment is the key. And how that relates to housing plans that Claire was discussing is the following. People often say, well, I may only come once a year, then we close the client out. Or, how do I know I'm going to see them again? Well, that's true with some organizations, depending on their program design. However, there are others that definitely implement a basic plan to address the need. Health crises should be based on, STRMU crises should be basically based on health or finances, and a connection, and then a plan, even if it's a short plan, individual to that person, should address how can we help alleviate that and work to ensure housing stability. And there may be people who come in and say, I just, I can't take care of it this month, but they come back over and over again. There's two reasons. They're living beyond their means. They need budgeting intervention and increases in income, and or the housing is just not appropriate for them and they really need to move. So we can do hours of housing case management, but I did want to say we understand that STRMU housing plans are challenging because they aren't ongoing. But we would like to think that you contact or see your clients periodically to at least check in. And of course, if they're coming back in another year and you haven't seen them for a year, they have to be judged eligible again. Okay, so that said, I'll get on with my parts. Just to let the folks at the door know, we have lots of seats from the middle up, probably 8, 9 seats, so please move people forward. We don't bite. So let's first talk about habitability standards. The HOPWA habitability standards for HOPWA I describe as sort of an overarching umbrella for the more detailed housing quality, HQS, housing quality standards that many of the HUD programs require, as well as Section 8, tenant-based rental assistance, housing choice voucher, et cetera. The HOPWA regulations discuss both, but it's not a requirement that the most detailed HQS are utilized. Now, that doesn't mean you can't, and nor shouldn't, because we do want to ensure that housing is habitable and meets good standards. So if you're an organization, you're not required to go out and do an inspection of the housing for STRMU, but you are required, or at least expected, to ask the question about the condition of your client's housing and help advocate for repairs as needed if possible. So that's something to remember. You don't have to do an inspection each time. However, you want to know that if you're using these federal funds to assist a household, they're not living in substandard housing. Let's see. If you are a person that does home visits and you know your client has utilized STRMU in the past, that's a very good time to do an observed deficiency while you're in the house and discuss that before the person comes back in for additional STRMU assistance. We often get questions about lead-based paint inspections when it comes to short-term rent, mortgage, and utility assistance. And there, I gave you the answer, didn't I? No, I didn't yet. True or false quiz. There are certain conditions in which lead-based paint requirements apply to the provision of STRMU assistance. True or false? True. They do apply if assistance, they do not apply if your assistance is in a 0-bedroom apartment. A studio and efficiency does not trigger HQS for lead-based paint. And it does apply if the STRMU assistance is going to continue for 100 consecutive days, or if the housing was built before 1978, or if the household has members who are pregnant or contain children under the age of 6 and under. It doesn't apply then, just the opposite, that if there are less than 100 consecutive days of assistance being provided, or the unit is 0-bedroom, the household does not have a pregnant or parenting of young children under the age of 6, and the housing was built after 1978. So this can be very challenging because under these conditions, you do need to be aware that if you are serving the population that triggers the requirement, a visual inspection should be conducted. Now, we don't have that a great deal in communities in the West as much. In some of the cities we do. But in many, many places in the East, I know there's housing that's very old, and there's many situations where lead-based paint abatement has not been done. So there's a couple of things. If you have no one that is trained to do visual inspections, and HUD does have some good curriculum online for doing visual inspections, you can contact a local housing authority inspector if you have a relationship with your housing authority, or your city jurisdiction housing inspectors to make sure that you know what to look for and that the home is inspected and evaluated. Also, many landlords who have done lead-based abatement have a certification from their city inspectors, and as long as you have a copy of that inspection abatement certification, that's fine. You just need to be assured that your household is not going to be living in a lead-based environment. There are requirements that we always talk about when you're thinking about lead-based paint. Whether a household or not has the requirements in terms of household size, women and children, age, etc., it's always good to have lead-based paint pamphlets available. We always think it's a good resource. Make sure you have those available. If not, you can find those as well online. You can print them off. If there is lead-based paint in the home, disclosure to occupants. Most landlords are aware of this as well and often will give them, but some don't. So it's our responsibility in working with young families and in older housing to be able to disclose this information. The visual assessment, paint stabilization is part of the process. If when they talk about paint stabilization, we're looking at chipping paint, powdery paint, kids bite on windowsills, and that's where a lot of lead-based paint comes in. So issues come in. So paint stabilization is important, ongoing lead-based paint maintenance and response to a child that has elevated blood levels. No, you're not expected to do all of that, but you're expected to make those connections if you're not an organization that does or contains certified inspectors. Doesn't come up a lot, but you need to know. This is the next area that I find we get lots of questions about at the AAQ, and that's ineligible costs. Claire talked about the eligible costs, but there are lots of ineligible costs, and this is where the challenge of assessment comes in. When someone comes in, they're in crisis, and it's usually financial crisis, but then you are required to scrutinize the need based on, I know you're in crisis, but are you in crisis because you overspent on your credit card? Are you someone that has high transportation costs, automobile, repair, gasoline, and you do not need your vehicle for employment and or school? Is this the highest use of your STRMU assistance to help someone with their rent because of that? You can't pay many of these things directly, but you have to think about what is the reason that someone is here, and is it related to health? Is it related to loss of income due to health-related issues? So you'll get all sorts of reasons, and part of it is an education. We have several seats up here. Please come forward. Happy to do that. So I think when we talk about assessment, there's a couple things to know. You first go back to the basic intent of the STRMU program, and that is housing stability. And if you have someone coming in who has huge debt issues, it may be policy that budgeting and money resource classes or case management is a requirement for utilizing your STRMU. I always say the good news about HOPWA regulations is they're only about this big. And the challenging news about HOPWA is there's not a ton written in the regs, but fortunately now we have a great user manual That talks about a lot of issues, including assessment. But of course, it never addresses every issue that comes in with your clients. There's always something. So, in thinking about assessment, you need to think about if we provide STRMU, whether you are able to provide 21 weeks, and I know no one that can really do that anymore, or utilize a cap that suffices for the 21 weeks of assistance. Regardless of any time limits you use, the question is my client going to be able to stay in this unit stably after we make the assist, or are they going to be going to a dozen churches for a $50 here and a $100 assist there and come back month after month, year after year? What's going on here? And it's a hard thing to say to someone that may come back time after time and is not willing to move to a more affordable unit. Remember, these are not assisted units with subsidy. People are living in market rate housing, whatever that market be. But it's not something that you can assume, well, because they have the need and they're here and they might get evicted. Yes, we're concerned about homelessness, but that doesn't mean your policy says we continue to help a person indefinitely. So, the good news about STRMU, it's a carrot to bring people in, engage them, and it's a stick to say we have some base requirements. It's not an entitlement. It's needs-based, and we're in a partnership. I have a lot to offer you, but your part and accountability to this is working with your budget, your situation to make some changes. Hard conversations to have. STRMU may not be used for folks that do receive an ongoing rental subsidy, such as HOPWA TBRA, Housing Choice Voucher, supported public housing, programs where they get significant portion of their rents paid. STRMU may be able to be used in some tax credit properties where developers are required to set aside a few units in each of their developments who utilize state tax credits. And some of those rents are at market. Some are for households at 60% area median, 40%, some lower. If you have someone who can afford a discounted rent, but it's not as low as paying 30%, you might want to think about saving your HOPWA STRMU assistance for market rate households or for the households that can afford to live in, pay the higher rents in a tax credit unit. So they're not automatically banned, but again, assessment is the key. And asking the questions. Your client may not know that they live in a tax credit unit, but you ask about their rent assistance, do they get any discounts, et cetera, and that's how you learn about that. And you may have to call the property manager to find out if it's a tax credit or if it's assisted with some personal or direct HUD funds to owners. So there are many programs that our clients don't know about. Households are currently homeless cannot use this money because you must be housed for a time in order to use it. Permanent housing placement funds are available for helping folks moving into new housing arrangements for permanent housing. STRMU is no longer. At one point, it did get used a bit for move-ins, but no longer. So moving assistance, security deposits, first month's rent, that can be utilizing the permanent housing placement funds if your budgets and your grantees have that element activity in your particular area. We talked about support for an open line of credit versus a second mortgage. Those are not allowable. And we talked about taxes and insurance paid separately. Those are important when you're a mortgage holder. Now, there are folks who rent condos, and clients should be aware that the particular owner, landlord, should consider what the total cost of sustaining that unit is, rental and condo fee, in the price that they charge, hoping it's reasonable. That's another thing. If the rents are, you do not have to follow HUD's rent reasonable standards, but you do need to really look not only at the person's budget and ability to afford a rent, but is it reasonable for the area? And if you know someone's living in a place that they're being overcharged, it's good to have a conversation about finding some alternatives. Now, when I talked about the ability to work with people as an engagement strategy and a carrot, more or less, to help them think about budgeting, this is a good thing. You don't necessarily have to turn someone away the first time they come in. So they may come to you for the very first time because they had a car repair, and we don't pay for car repairs, but we can help with your rent or utilities or mortgage in certain cases. However, please be advised that there's some budgeting that goes on here, and this is not a reason we'll continue to provide STRMU to you. So those are the kinds of internal policies to try and tease out with your case managers, housing providers. Grantees' policies and procedures sometimes contain that level of detail, but if yours does not, organizations in your community should. And if there are multiple organizations using STRMU in your eligible metro area, get on the same page and ensure that you do not have clients shopping for multiple STRMU assists. We, in my community, when I was working in Seattle for years, we had a clearinghouse agency that checked. So if someone went elsewhere, we could, with the release of information, we could check, have you received STRMU elsewhere? Okay. Household furnishings, supplies, and such. We talked about those as being available in some cases through HOPWA support services, but on the other hand, we encourage people to utilize as many of the other local opportunities available, such as thrift stores. We have a share house in our community where people donate furniture available to homeless families and new move-ins who are low income, that sort of thing. Supportive services sometimes can pay for vouchers to a thrift store, but there are other sources of funds that can pay for furnishings, and certainly we don't pay directly for transportation, phone costs, DirecTV, cable, those sorts of things are often a reason that people cannot cover their rent. Well, this is not a reason that STRMU is available to them. It's a matter of teaching people, in many cases, how to budget. I learned very quickly that many people did not have strong money management upbringings, and they may not have had good examples in their life for money management. And that's why we are charged with being mentors to people as well as program administrators and setting bottom line policies. Eligible STRMU periods and payments. This one can be confusing as well because the guidance allows a variety of ways to think about your program. What I would say, if you are the only STRMU program in your eligible metro area, then you can pick a way of doing this. Some grantees choose the way they want to administer. Some allow their project sponsors to pick these particular ways to count. However, if you have multiple agencies with that money in your jurisdiction, we always recommend consolidating your policies, especially with STRMU, because there's so many variables that can go wrong here. Grantees and sponsors must select one of two methods for defining the start date and end date of the eligible STRMU period. So the regulations set a 52-week period for all households, and that can be based on the formula grantee or your competitive grantee operating year based on their contract with HUD. The calendar year from January 1 to December 31. Some people use fiscal years, and we know that can be challenging. Ryan White ends in March, and HUD's fiscal year ends in September, and ours was December 31st, and you have lots of options, but it should be consistent, and one of them selected. Or you can do a unique period for each individual based on the time that the STRMU funds pay for the debt. Here's where we see huge variations and confusion. We had a program for a long time that started counting the weeks of assistance provided the date that their STRMU check was cut for that client. No, it's not covered. It doesn't indicate anything about the period it's covering. We've had others that have someone coming in and they may help them with the last week, they're just short a little bit, and they may just start counting their 52-week period at that time, and some go way back if they're paying debt in arrears. The way that this should be handled is that the 52-week period starts on the first day of debt owed by that rent, mortgage, or utility. So we have an example here that a household receives STRMU rent and utility assistance due on April 1. The current bill is due on the 5th, like many rental policies, so that your account period would be April 1 to the end of, end of March 31st the following year. So it's at the time, that's the 52-week period. But we'll talk about now counting the days and how you experience counting the actual number of days. So the year can be any of the calendar years and fiscal years we talked about, or when the client first comes in for their first STRMU request, that's their anniversary date for the 52 weeks. Counting the eligible STRMU period allows for 3 acceptable models, and this too can be challenging. You should choose one method, and grantees and sponsors have to be consistent in utilizing this particular method. You can count the actual days of STRMU assistance paid on a debt on behalf of the household. So if you have the ability to fund 21 weeks of rental assistance, that consists of 147 days. Now, I do know programs that do use the days because it's really clear. We paid a month of rent for February. February had 28 days this year, and so we are counting 28 days. Or we help someone, we encourage them to pay at least half their rent if they can, save some of their 21 weeks or cap, whatever your cap may be, and we only help them with 1 week that month of rent. So you could just count 7 days. So you have a number of ways to do that, but the number of days, so an example on the utility assistance here is that if the bill was paid for a paid in full for a service period, June 17th to July 16th, there are 14 days in June, 16 in July, making a total of 30. Now, again, we just talked about a portion. I always encouraged our clients to pay a portion because this is not an entitlement program, and we want people to know that we're here to assist for the most dire need and that we have more requests than we ever have money. So let's talk about and look at your budget and see what you can actually pay. It's okay to make a requirement that people pay a portion whenever possible. That's a local policy that grantees should consider. That doesn't mean that if someone is in housing and they've lost their job, for instance, and they're on unemployment at a much lesser amount, but they're soon to get back to work and you know more about their life, doesn't mean you can't pay a full month's rent. But again, it's your assessment that's determining what the future will likely be for that person. So we have to think what's currently happening for our households as well as where they're moving in the future and how STRMU might help get them there. If you have clients that come in and you say, this is it, you're living beyond your means, you assess it, of course you will work with that person to understand that. People are afraid to move. It's expensive, it's daunting, it's labor intensive, it's scary. Home is very emotional for all of us. And STRMU is a wonderful way to engage people to start thinking about that. So you may help someone determine, all right, we'll work with you this month, and we're going to start a housing plan for looking for more affordable housing. Here are some resources, here are some options, here's the support we can provide you. Please understand that it's your choice, but STRMU will not be available to you on a reoccurring basis in this particular residence that you cannot sustain. Those kinds of conversations are hard to have. I remember them. You know, your heart goes out, you want to help people. The other thing that, well, let's get through the counting, and then I'll bring up something that we often face here. So here it talks about if a portion of a utility bill was paid for the period of June, you count the days, and then you can also divide the total bill by the number of days you assisted and pay that portion. So the total bill is 160 for a 30-day service period, and STRMU pays 125 of that. Well, how much time do I attribute? Well, you divide the total 160 by 30, which is 533 a day, times the number of days you helped with. So here's the second method, and this one is used frequently as well, rounding down to 4 weeks equal 1 month. And of course, if you take that out, in the end, basically, a month is, if you round it down, you basically get 5 months of assistance, which is 20 weeks, not 21. But we understand that, but it is, for some folks, easier to track that way. And therefore, again, if you're using a month at whatever you pay, and in this example, the total rent is $1,000, and you're encouraging your client to pay some of it, then you might pay a portion, 75%, 50, or 25, and then breaking it out about how much money that is and how many days are attributed. So if you pay for a week, or you pay for 2 weeks, or you pay for 3 weeks. It's not always, except for counting the days, it's not an exact science, but you do have to have a policy and follow that as carefully as possible in counting. And then the third method calculates the number of weeks in a month. So there are actually 4.33 weeks in a month. And again, some people actually track it this way. So if they pay 75% of the month's rent, that's 3.2 weeks. 50% is 2.2, and a quarter of the rent is 1.1. So there are a number of ways. If your agency does not have a set policy, it's important to do so. If your grantee is involved with your policies, they may have their own, but if not, something to talk about, because the manner or the amount of HOPWA funds you have for STRMU may be limited, and you need to think about this. What this leads into is the amount of assistance and capped payments. So the regulations do allow up to 21 weeks in any 52-week period, as we discussed, but it also has to do with how much money you have. Some people say, but we like to use STRMU because we can serve so many more people. Is that the goal? How many folks think serving more people is the most important thing in this program? Good answer. Nobody raised their hand. HUD wants you to serve as many people as possible. However, numbers are not what we're after. We're after housing stability. We're here to help people remain in their housing. And remember, since STRMU does not get utilized for a subsidized program, if folks are in affordable, somewhat affordable housing for their particular financial situation, that's a good thing. Let's try and keep them there. If they can afford that housing and you don't need to put in a transition plan to move them, it's really important to stabilize them. So you want to ensure that your policies provide enough money to try and help a person get through a crisis, but not so much that, as many of us know, People come back year after year. So how many of you would say that you have clients that show up on day one of their 52-week period to claim their STRMU? Biggest issue. It's not a reoccurring payable, and it is needs-based. And yes, many of our survivors that have been around for a lot of years, we're so grateful to them for their ACT UP efforts. We wouldn't have STRMU without them. It is not a reoccurring payable, and our disease has changed. The epidemic, yes, it's an epidemic of poverty, but it's also one that we see more people living and working and contributing. There's a self-sufficiency element to HIV/AIDS that didn't exist before. And as you heard this morning, there's some wonderful opportunities around employment and training coming down the pike. So that doesn't mean people will never need STRMU again. Even people working part-time might, but it is not a reoccurring payable. How do you change that attitude with your long-term clients who are back every year? Big conversation to have within your organization. For those who were part of my policies and procedures presentation yesterday, we talked a bit about this. You have to make a full paradigm shift about what the purpose of this program is. And organizations oftentimes don't think about how they're going to newly market STRMU. What should STRMU be? Short-term, get you through a crisis, and no guarantees that next year we'll have this money or that you'll be eligible if things haven't changed in your life. So thinking about reframing the program, educating your case managers, your Ryan White folks, any of those folks who refer clients to you, helping them understand that we have made a shift and we need to, because modernization is taking place with dire effects in some communities. Some communities will get increases, but they won't last forever, and we never know from year to year what Congress is going to allow in terms of the dollars available. And so this said, I would say to you that it's time today to go back to your organization and sit down and talk to the folks involved to say, are we administering this program within guidelines? Are we really meeting the need as much as possible? Or are we just giving this money away because it's here and we can serve a lot more people? And, oh, by the way, they expect it. So once you've done that thinking and some education with your case managers and referring housing advocates, et cetera, then comes a brochure, a means of discussing this with your clients. It's saying there's some big changes taking place with our STRMU program. HUD is really emphasizing some self-sufficiency measures through employment and getting back on benefits, and we've got some things we can refer you to, but not coming back every year. The other thing to remember is some of the people who've come back for many years are over the age of 55, and guess what? In the beginning, they didn't live that long. Senior housing options are huge now in many communities, and we don't even think about that. And many of the younger folks coming in to care earlier and on the drug therapies are able to still work part-time or full-time. So we have to really be thinking about that, and just because you administered STRMU one way in 1995 does not mean that's your program today in 2017. Okay, I'm very close to the end here, so let's talk just briefly before I end on amount of capped payments and limits on assistance. So since most places don't have enough money, we definitely suggest that you think through, if you're going to make a capped payment, what does that look like? So some areas will cap the amount of times a person can access STRMU during the program year. Do not say once a quarter, once a month, because that throws your policies off in terms of your counting and your requirements. And people then expect it once a quarter. It's important to say that, and not give a set dollar amount. Know that we may have funds available at the time you need them, we may not. And even if you have a cap internally, and that folks know that you do have a consistent cap, it doesn't mean it's an automatic payment. So caps can be on the number of assists, the number of dollars provided to a household. Some places kind of think through a housing debt to income ratio, which isn't always easy to do, but something to think about. And limiting, again, the assistance to folks who use local housing authority payment standards. So some places say, well, we aren't going to serve folks that live in housing beyond their means. We're going to serve people who are living in rent reasonable, fair market rent, or housing choice voucher payment standard housing, even though they're not receiving the assistance from subsidy from those sources, but we're looking at more affordable rents. So you do have some options, but it has to be uniform, consistently applied. We've talked about a lot today, and we'll certainly have some time now for questions, but I just wanted to remind you that the goals are for eligible and ineligible costs, methods for counting STRMU weeks, components of service planning, the amount of assistance, how to apply for achieving housing stability as much as you can in the long term. And if you have a client that comes in every year for maybe a month or two of assistance, who may be working part-time or agricultural work or seasonal employment or part-time, but 10 months out of the year they're sustaining their housing, that's a valid use as well. So repeat doesn't mean entitlement, but it can mean the person is sustaining. So don't forget these things, and as people come in and ask you questions and you want to describe your program and reframe it, these are the kinds of things to consider.